I will introduce a program launched a few years ago by AdMeTech Foundation, our international working group in focal treatment of prostate cancer. The idea of this working group started taking shape at the 5th Annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer in 2021. Just about every speaker in session on focal treatment or partial ablation in 2021 presented a promising potential of minimally invasive treatment for reducing complications and improving quality of life compared to standard whole gland treatment, and yet highlighted the need for definitive phase 3 clinical trials to study if cancer control can be maintained, particularly long-term. Later in 2021 and early 2022, we saw publication that reflected an international consensus of multiple institutions sponsored by Focal Treatment Society and led by Dr. Giancarlo Mara. This article began with the following statement: focal therapy for prostate cancer is promising. However, long-term oncologic outcomes need further data, and there is no consensus on follow-up strategies. Later that year in 2022, during 6th Global Summit, we heard similar recommendations rather familiar by now. Minimally invasive treatment has a promising potential, but we need definitive phase 3 clinical trials to study cancer control. That reminded me what prompted us to establish an international working group in prostate MRI around 2007, where Dr. Hedy Hrycak, one of its clinical pioneers, expressed her concern that we might see another 20 years of a promising potential of prostate MRI. Consequently, AdMeTech's MRI working group was established and expedited international consensus, pilot standardization, and clinical evaluation and implementation of this technology. During Summit 2022, we have also seen data showing limitations of MRI and PSA in studying intermediate outcomes of focal treatment, such as residual or recurrent disease. Over the last few years, we have also seen important advances in ultrasound, molecular and multimodality imaging, and their potential role in patient care. Andrei Ayagaru of Stanford, Fiona Fennessy of Harvard, and Daniel Song of Johns Hopkins presented preliminary data also in 2022, showing that PSMA PET, when integrated with MRI, improved treatment planning and monitoring compared to MRI alone, including target definition, staging, and response assessment. They pointed out that further research is required, including development of imaging-based short-term and medium-term outcomes. During Summit 2022, our speaker showed growing evidence that image-guided minimally invasive procedures provide comparable cancer control with significantly reduced complications compared to whole gland treatment. And yet we need definitive phase 3 randomized clinical trials. And the fundamental challenge in the design and implementation of this is development of short-term and intermediate patient outcomes. Precision diagnosis is critically important for risk assessment and patient selection for image-guided treatment and post-treatment follow-up. While MRI has been used most extensively, we have seen the emerging role of advanced ultrasound, molecular and multimodality imaging, and radiogenomics multiomics for target definition. More research is needed for improved patient selection and monitoring during and after treatment. Almost every speaker in the session highlighted a slow pace of clinical acceptance of this technology, largely due to the lack of definitive data. If validated, focal treatment may become an important future addition to management strategies for patients in a gray zone, where risk assessment leaves clinical questions about the appropriateness of active surveillance or the necessity of the immediate radical treatment. Focal treatment may become an additional option for curative, palliative, or deferred interventions. In 2022, we continued and expanded our discussion about establishing a working group to expedite development of the research strategy, clinical validation and adoption of focal treatment, defined as a partial ablation. Indeed, following the summit, we invited leading experts from urology and radiology to serve on the executive committee in order to outline the working group agenda and broader participation. This effort is modeled after AdMeTech Foundation's International Working Group in Prostate MRI. Agenda items included reaching consensus on clinical and research needs and related research priorities, including a possibility of generating definitive data based on the phase 3 clinical trial or patient registry approach. By January 2023, a formal executive committee was established. Between May and September 2023, we held a series of consensus meetings. Since September and until now, we created and proceeded with deliberations of the MRI subcommittee and molecular imaging subcommittee. Originally, since early 2023, our executive committee had about 15 members, all senior academic leaders from urology and radiology. The first meeting took place in May 2023. Upon our request, Rafael Sanchez-Salas reported on the emerging consensus of more than 200 experts. He pointed out quality of life outcomes, patient benefits of focal treatment are better than radical surgery, but more work is needed for the assessment of cancer control. This was in alignment with Summit 2021 and 2022. Between May 2023 and September 2023, we had a series of meetings reaching unanimous consensus to focus on patient evaluation after focal treatment as the area of the critical clinical need, with imaging as the priority. From a strategic perspective, imaging may enable generic assessment of normal and cancer tissue response to treatment, irrespective of the multiple treatment modalities and related sources of destructive energy currently in use. The following specific goals have been outlined. Develop imaging-based, short and immediate term post-treatment outcomes. Define residual and recurrent disease. Create and test post-treatment MRI standardized reporting and study emerging role of molecular imaging. Between September 2023 and now, we have established and proceeded with deliberations of the MRI subcommittee and molecular imaging subcommittee. MRI subcommittee, led by Dan Margolis and Francesco Giganti, focused on standardized MRI reporting. This group reviewed emerging scoring systems, including PIFABS and Target, prioritized development and evaluation of the next generation standardized reporting that would be broadly accepted, and focused on the design of a clinical trial. We will hear more detailed information on these findings and recommendations later in this session. In parallel, Molecular Imaging Subcommittee, led by Andrei Ayagaru and Stefano Fanti, reviewed emerging research and found that preliminary data was quite scarce. Stefano Fanti and his team at University of Bologna conducted a promising pilot study that he will present, and the group designed a multi-center study. Stefano, Irene Berger, and Hein Duane will discuss their findings and recommendations. What is the expected impact of our international working group? From a clinical perspective, we anticipate improved diagnosis, such as, for example, differentiation of post-treatment changes in normal and cancer tissues vis-a-vis residual or recurrent disease and target definition for biopsies. Improved risk assessment and selection of patients for biopsies. Improved predictive assessment for planning management strategies, such as, for example, monitoring with PSA or perhaps other liquid markers, and optimizing protocols for imaging, biopsy, or other clinical interventions. From a research perspective, we hope to achieve an expedited development of short-term and intermediate-term patient outcomes critical for clinical trials, acceptance, and adoption. From a public health perspective, we hope to see an optimized clinical value and quality control of focal interventions. It is particularly important now when utilization of the focal procedures, still largely experimental, have been rapidly growing. Thank you for your attention.